preparedness and response arrangements, including the human-animal interface, to help anticipate and prevent future pandemics and address them more effectively when they arise. And third, sustained, predictable funding for health emergency preparedness and response, including through innovative financing to support preparedness measures and help ensure that the world is prepared and can respond to the emergence of high-risk pathogens. Finally, this should all be built on a solid foundation of governance and oversight mechanisms to increase trust, ensure accountability, and foster transparency. I thank you.
Thank you, DG. Thank you, Dr. Tedros, for your wise words and leadership, and also for setting the scene for today's discussion. Unfortunately, President Charles Michel, President of the European Council, could not be with us because he is sharing now the European Council meeting. But he did share with us a video message, and let us take a few minutes to listen to his thought on this initiative.
Good morning, good afternoon, and good evening, everyone. Today, we are calling for an international treaty on pandemics. The COVID-19 pandemic is indeed much more than just a health issue. It has cut across every sector of our societies, highlighting our strength and exposing our weaknesses. And above all, it has taught us one brutal lesson: no country, no continent can defeat a pandemic alone. It requires a global approach, the us rather than the me, and a collective commitment at the highest political level. The next pandemic is not a question of if, but when. So we must be ready, and we have no time to waste. This treaty on pandemics would be rooted in the Constitution of the World Health Organization. It will support the principle of health for all. And through this treaty, our main goal is to foster a comprehensive approach to better predict, prevent, and respond to pandemics, to strengthen global capacities and resilience, to ensure fair access to medical solutions, and to bolster international alert systems, data sharing, and cutting-edge medical research. We affirm the importance of a One Health approach that connects the health of humans, animals, and our planet. And for this double approach to work, we need more transparency, more accountability, and more shared responsibility in the international system. COVID-19 has been a harsh reminder. No one is safe until everyone is safe. And that's why leaders from every region of the world have come together to propose collective action at international level. Immunization is a global public good, so we need to be able to develop, manufacture, and deploy vaccines as quickly as possible. And we also need to ensure universal and equitable access to vaccines, medicines, and tests. COVID-19 has exposed weaknesses and divisions across our societies. And now it's time to come together as one global community to build a pandemic defense for future generations that extends far beyond today's crisis. And for this, we must translate the political will into concrete actions, just like after the atrocities of World War II. Visionary leaders came together to build a multilateral model and to strengthen international cooperation. Today, more than ever, it's our responsibility as leaders to ensure that our pandemic preparedness and our global health systems are fit for the 21st century. Today, we are guided by a spirit of collective solidarity anchored in the principles of fairness, inclusiveness, and transparency. Let's work together to leave a legacy we can all be proud of. Thank you.
Thank you very much, President Charles Michel. panelists who are going to address this meeting spent recent months reviewing diligently member state and WHO response to COVID-19 and the existing mechanism and capacity to respond to a potential global pandemic. And of course, you will be briefed on their work in 30 minutes in Committee A of the Assembly. But today, and during this session, they will brief us on their funding recommendation with regard to the potential global agreement on pandemic preparedness or treaty and response, their views on the need for such initiative and the urgency of it. Of course, there is other panels who spoke about potential pandemic treaty, and we're here mention the panel on the European panel Commission on Health and Social Development chaired by Dr. Mario Monti. It is my pleasure to start now giving the floor to the panelists, but I would kindly remind our panelists that they have 3 to 4 minutes to present, to allow time for question and answer. It's my honor and pleasure to start by the Right Honorable Ellen Clark, co-chair of the independent panel, who will reflect on the panel's views on the added value of Framework Convention on Pandemic Preparedness and Response, and also explain to us what they propose that this framework should be under Article 19 of the Constitution, and why they propose that the work should be done in 6 months, taking in consideration the urgency of the matter. The Right Honorable Ellen Clark, you have the floor, and thank you for joining us today.
Thank you, Mr. Moderator, and greetings to all participating in this event. Yes, the independent panel has recommended the adoption of a pandemic framework convention within 6 months, using powers under Article 19 of the WHO Constitution. We see the convention as being complementary to the international health regulations. We think its negotiation should be facilitated by the WHO and with the clear involvement at the highest levels of that negotiation of governments, scientific experts, and civil society. With respect to the 6 months, we think this is urgent. We have likened this moment in global health to the Chernobyl moment in nuclear safety. We know that post-Chernobyl, it took about 5 months to get 2 new conventions, much greater information sharing and cooperation between states, and also more powers for the agency concerned, which was the International Atomic Energy Agency. In essence, that's the package we would like to see to support WHO and support the world to do better on the response. So we would see the convention filling gaps in the current legal framework. We would see it clarifying responsibilities between states and international organizations, including obviously WHO. We would see the convention reinforcing the obligations and norms for the conduct of all states in ensuring that they are prepared in the event of a pandemic, that they meet reporting and other obligations, and that they respond to an outbreak when they need to. We think the convention could usefully support the empowerment of WHO, setting out what its authorities and powers are. And we've been specific that we think it needs to have unfettered access to sites of outbreak. It shouldn't need to go through a negotiated process to get that. And we believe it needs the power to publish information that it believes is in the public, global public interest to have out there. Usefully also, the Pandemic Framework Convention could set out principles and mechanisms for financing preparedness and early response, and for supporting the global public goods of vaccines, therapeutics, diagnostics, and essential supplies and technology transfer. So in summary, we say, seize this moment, use this next 6 months, and get a pandemic framework convention in place which will support and empower the WHO and enable member states to get on the front foot next time there's a pandemic threat. Thank you, Mr. Moderator.
Thank you, Excellency. Thank you for this wise word and also for your leadership in conducting the work of the IPPR and looking forward to hear your report in a few minutes now. Our second speaker is Mr. Hajsi, the co-chair of the Global Preparedness Monitoring and Board. And as you know, Mr. Hajsi is, as his role of Secretary General of the International Federation of Red Cross and the Red Crescent Society, led the world's largest humanitarian network and led several negotiations on global agreement. And on behalf of the GPMB, Dr. Hajsi, on your report 2020, the GPMB called for an international framework on health emergency preparedness and response, incorporating the IHR among other things. Your advice and your comment to this meeting are highly welcome. Over to you, Hajsi.
Thank you very much. My greetings to all highly respected colleagues and friends that are on this panel. The Global Preparedness Monitoring Board has been established really because of the situation that Dr. Tedros addressed at the beginning: fragmentation, lack of solidarity, lack of collaboration, and even competition. And we wanted to get out of that cycle of panic and neglect that we were finding ourselves in every time we were confronted with the shock and hazard and then waiting for the next one to happen. In September 2020, we wanted to provoke really a shock and send a wake-up call by calling our report "A World in Disorder." Indeed, there were a lot of lacks, and it was quite frustrating to see the good analysis being done by everybody in that regard and not seeing action taken to address that fully. And one of the main recommendations that we've made were all articulated around strong leadership and also active citizenship, so that we hold each other accountable at all levels to prepare, better prepare, alert early, act early, and work in collaboration and in partnership in responding to the challenges that we face. I will not repeat, the gaps that we've seen, because this has been all over again, repeated by all our report and introduced by Dr. Tedros, at the same time. But we called on the UN Secretary General at the time and the WHO Director General to convene a UN summit on global health security in order to agree on an international framework for health emergency preparedness and response. We had identified several gaps, and then we believe that unless we have the political commitment at the highest level and a framework that is a basis upon which one could be acting on, we will not read that. So we believe that we must now act very, very urgently, and countries must sustain their commitment to preparedness and believe that a treaty can be an important tool to ensure this. So unlike the other areas of work that we all are concerned about, such as climate change and others, we do not have yet in the area of global health that kind of a level of commitment and the binding type of legal framework that is pushing us forward. We support the recommendations made by the IPPR as introduced by the Right Honorable Ellen Clark, and we would like to see our partnership further strengthened and then building on the recommendations of the GPMP and continuing our work, not only to monitor, but also to incentivize action and then to provide support to all, so that we can get into that partnership, solidarity, and collaboration that is badly needed. None of us alone can make it, and all of us at all levels, and including citizens and communities, where epidemic starts and an end, that will be involved the right way, not only when we are confronted with the shock, but before, during, and after. It is that continuum that will be the basis for the long-term partnership and collaboration we would like to see. The GPMB will stand on your side in that journey. Thank you very much.
Thank you, Hassi, for this very strong word, and thank you, GGPMB, for leading the advocacy for national and global preparedness. And thank you also for your personal commitment to putting communities at the center of all these processes. Our third panelist is Professor Lucille Bloomberg, the Vice Chair of the IHR Review Committee. And Professor Bloomberg, the IHR Review Committee has had a huge undertaking over the past few months, and you relied heavily on evidence and outstanding expertise of your member under the leadership of Professor Lothar. But one question that all member states ask when we discuss with them the potential treaty is how this treaty can add value to the IHR, to already existing IHR. And I know that your committee has debated that, and you may wish to share with us your finding and conclusion. Over to you, Professor Bloomberg.
Thank you. Thank you very much, honorable delegates and excellencies. Thank you very much for this opportunity to present the view of the IHR Review Committee. Our mandate was to review how the IHR were implemented and adhered to during the pandemic, and we concluded that the IHR fulfilled its original aim as the agreed framework for global health protection, and no amendments are needed at this stage. However, there were problems with interpretation and implementation of the IHR by both WHO and states parties, and we've made specific recommendations which are shared in the report and in the following session. I think we noticed that in our review that the IHR provisions mostly concern detection, assessment, and alert provisions, as well as preparedness for core capacities. But there are other elements required for a comprehensive global architecture for emergency preparedness and response, which seem to fall outside of the IHR. And this has made us consider there may be benefits in agreeing on a global legal mechanism that would outline such provisions while supporting and complementing IHR implementation, and this could be done through a pandemic treaty. So Article 557 of the IHR addresses the relationship of IHR with other international agreements and anticipates that special treaties arrangements may facilitate the application of the IHR. We recommended that the WHO and states parties should develop a global convention on pandemic preparedness and response in support of the IHR implementation, and that such convention may include provisions as follows: strategies for the rapid and timely sharing of pathogens, specimens, and genome sequence information for surveillance and the global health response, including the development of effective countermeasures. Provision for equitable access globally to benefits arising from sharing the above. Provisions for rapid deployment of a WHO team for early investigation and response, extending the global supply chain, as well as prevention and management of zoonotic risks as part of a One Health approach. We also outlined enabling factors, which include sustained and predictable funding for global emergency preparedness and response, peer and expert review processes, measures to promote compliance, processes for structured normative development, and importantly, protection of human rights and privacy in context of surveillance technology. So I think we join the other committees in supporting the development of a global response of IHR implementation. Thank you very much.
Thank you, Professor Bloomberg, and thank you for summarizing 8 months work of the IHR committee on this important issue. Our last panelist is very well-known global public health leader. This is Professor Walid Ammar, who spent all his career preparing and responding to emergency in his capacity of Director General of Health. And he is member of the IOC, the Independent Oversight and Advisory Committee, and he will share with us the views of the committee on this important topic. Professor Walid Ammar, you have the floor.
Thank you. Thank you, Jawad. On behalf of the Independent Oversight and Advisory Committee, I thank you for inviting us to this important side event. The COVID-19 pandemic has exposed failings in pandemic preparedness and response across the world, and a shortfall in health security and equality. Both national and international systems have struggled to meet the challenge of the pandemic, while health systems have been overwhelmed, leaving people without access to adequate health care. The pandemic also revealed a lack of international solidarity and inefficient global health governance to correct for global market failure. The consequences were insufficient production of and inequitable access to global common goods for health, such as laboratory tests, PPEs, medicines, and vaccines. The COVID-19 pandemic has given us valuable lessons. There is no sense in seeking to eliminate the virus in selected countries, regions, or areas. One thing is clear: an individualistic attitude impedes progress. In a pandemic, no one is safe until everyone is safe. Hence, the forward approach must be adopted. The way forward, therefore, undoubtedly lies in a greater global solidarity and a stronger multilateral cooperation and a multi-sectoral approach to increase global capacities for preparedness, readiness, and response to health emergencies. A pandemic treaty would complement IHR, particularly in terms of primary prevention, through upstream measures to prevent zoonotic diseases from crossing into the human population. Hence, it will consider the One Health approach, linking human health to animal health and the environment. The treaty would also ensure compliance with IHR, build national, regional, and global resilience for pandemic responses, mobilize financial resources collectively, and ensure universal access to diagnostics, treatments, and vaccines for future pandemics, based on the principles of solidarity, equity, transparency, and accountability. IOAC appreciates that an international treaty is member states' prerogative. It provides, however, a great opportunity to engage with multiple stakeholders and sectors beyond public health to strengthen national, regional, and global capacities and resilience to future pandemics. And WHO is expected to play a central role in this process. Thank you.
Thank you, Walid. Thank you very much. And thank you for all our panelists for your time and your reflections. Your recommendation definitely will be important in guiding and shaping the future of this project. Now I would like to open the floor for question and answers, keeping in mind that we need to stop 5 minutes before 2 to allow our panelists to connect to Committee A because they will be present in the assembly, and also to give opportunity to our panelists to respond to the questions. The floor is open, 1 minute per question. I see no hand raised. If there is no question, maybe I will turn to Dr. Mike Ryan to give some comment. We have Egypt, sorry. Egypt, please. Dr. Ahmed, please, تفضل.
Thank you. Well, I needed to be unmuted from your side, and I clicked whatever. I'm just breaking the ice right now. Well, thank you very much for intervention that we've heard from all the panelists. It's very helpful and very remarkable. Just the only question that I need to discuss right now, the issue of that we all hear, and honestly we have some concerns, but we support the idea of the treaty because we know how much it's important. Really, it's really timely in this major event that we have. But my concern, and not my concern, concerns of many others. What's the idea? What's the panel's belief in the idea that we right now in the middle of the pandemic, we still and this pandemic, I don't know, I'm not that experienced. You can tell me it's very dynamic. What is right in the beginning, probably in the middle is not that right. Probably after a while it's wrong, and things getting the importance of things is fluctuating. We don't know a certain pattern dealing with this pandemic. So, what's your idea about the lessons learned, the good practices from this pandemic, which should be reflected in a way or another in the treaty? How can we, during the pandemic and while drafting the treaty, how can we mix the lesson learned while we're still learning with the drafting of the treaty yourself? Beside the things that is really eminent, like the IHR, like other things that is really eminent and needy, and we must tackle it as fast as possible. Thank you.
Thank you, Wajid, for this very important question. I see the IFMSA.
Thank you very much. And thank you so much for also this very interesting and relevant panel. My name is Iris. I'm with the IFMSA, which is the biggest and oldest youth-led organization, and we're in official relations with the WHO. And my question would be, what is the importance of civil society and also particularly youth in the successful implementation of the treaty? Thank you very much.
Thank you, Iris, for this important question. I don't see any more questions. Maybe I will turn to the panelists who would like to respond to these questions. Please feel free. Yes, Excellency, please. Professor Bloomberg, you want to speak on that?
So I'm not sure if you can hear me. I think one of the most...
Yeah, go ahead, Lucille.
I think in the middle of a pandemic, which may last some time, I think one of the most important things is equitable access to countermeasures. And this has to include vaccines. And I think that's an important part of the treaty. Thank you.
Thank you very much. Excellency Ellen Clark, you would like to comment? I see your hand, unless that I'm wrong.
Thank you, Mr. Moderator. And just responding to the very constructive comment from Egypt. On best practices, the independent panel has now published a study it did of the range of national responses to the pandemic. It didn't attempt to survey every country, but it did a representative selection, if you like. And from that study, we set out what appeared to work well and what didn't, and that may be of interest to member states. It's sitting on our website now. But also, I think in terms of best practice, where the Pandemic Framework Convention can be helpful, is in reinforcing both norms and obligations for the conduct of states in ensuring that they are prepared in the event of a pandemic and that they meet reporting and other obligations and can respond to an outbreak when they need to. So I think it can be a very helpful convention and reminding everybody of our mutual responsibilities. Thank you.
Thank you, Excellency, for your wise word. And I will propose to stop here the question and answer and to turn to Mike Ryan for some concluding remark, because all of us, we need to go back to Committee A. Oh, I see US.
Thanks very much, Mr. Chair. I think we just had a follow-up question for those who were involved in the independent reviews. Just following on the comment from the delegate from Egypt, we recognize that there are a number of recommendations that have been put forward, and as in addition to a number of different processes. And I think what we'd like to know a bit more clearly is how you all see any legal framework connecting specifically to calls for sustainable financing, particularly at a national level, but also through any global mechanism, because I think we'd like to understand more how the various recommendations and instruments or platforms and mechanisms would come together. Thanks very much.
Thank you very much. I'm sure one of the panelists will respond to this very important question. Yes, Excellency, please go ahead. Thank you.
Thank you, moderator. I think all these things are for member states to negotiate, aren't they? But I think Dr. Tedros referred, and I also referred to the potential for a framework convention to set out principles and mechanisms around financing preparedness and early response. And then it's a question of how much detail you go into. Do you, for example, in the treaty, set out institutional responses? The independent panel recommended an international pandemic financing facility with a funding mechanism which would be based on capacity to pay, burden sharing, and would be a universal formula. So the question for member states would be how much detail do they want to get into in a convention? Do they want to spell out institutions? Do they want to spell out mechanisms and formulas? I think that's all for member states to discuss.
Thank you, Excellency, and thank you all panelists for being with us today. I really we need to stop now because everybody will need to go to the Committee A, and I will give the floor for 2 minutes wrap up to Mike Ryan. Mike, please.
Great. Thank you all, and particularly thanks to Helen, Lucille, Al-Haji, and Waleed. It's very rarely I get to speak before people who I consider to be personal heroes. So thank you for joining us today. I think there was one question I just want to start with, because I think it really does speak to the question from civil society on youth and how can youth contribute. And I think that goes to the heart of this issue. We need a safer, fairer, more sustainable world. We need, in many ways, to write a letter to the next generation. I've been around, unfortunately, in and out of WHO since 1996. We witnessed the Kikwit outbreak, and after which we were going to improve everything. And then the massive meningitis outbreaks in the Sahel in between 96 and 98, and then the huge cholera outbreaks in the Horn of Africa, and we were going to fix it then. And we did. We made the ICG mechanisms, and we put IDSR in place in Africa. We half fixed it. We quarter fixed it. Then we had SARS in 2003, and we were certainly going to fix it then. We were absolutely going to fix it. We didn't fix a thing. Then to H5N1 in 2005. And we definitely going to fix it then because there was a pandemic imminent, but we had to get a kick of the pants from the 2009 pandemic. And then we were going to fix it then, and then we fixed it, half fixed it with PIP. We didn't go all the way. We made huge progress, but we didn't go all the way. Then Ebola, 2014, the story goes on and on. I think, Helen, you referred to this in the IPPR report, and GPMB have referred to it before. We have no shortage of recommendations. If I had a recommendation $1 for every single recommendation that's been made in this space, I would have a completely funded program, and we mightn't even be having this meeting. I'm sorry to bring a bit of humor to it, but I think we have to, and this is where youth, I think this is about your future. This is about the world you want. It's the world you want to inherit, and we've got to give it to you. And you need to make us accountable to deliver on that for you. And that needs not just a 1 or 2 year or political cycle agreement. That requires a generational agreement, a generational commitment to fix what we broke, and to ensure that you as youth, your children and your children's children will live in a fairer, more equitable, more sustainable and safer system in which we can all thrive and be at one. We see from the Secretariat's point of view, and this is with the Member States, and we thank you so much, all our Member States, for the huge engagement. And I know it's not been always that easy, but it's fantastic to see a democratic process in place between 194 Member States, differences of opinion for sure, but not differences in intent, not differences in emotion, not differences in desire, maybe differences in how we achieve the destination, but a fundamental agreement that we need a foundational underpinning for the next 10 years, for the next 20 years. We need to build the roots, not the tree. We need something that's going to stand the test of time. We cannot design everything into that. We will have to build new infrastructure, new systems, new governance, new finance, new platforms. That cannot all be specified. My own view is, and this is, I'm giving you my personal opinion, I think the desire of Member States is to have a very high level commitment, a political treaty that makes the highest level commitment to the principles of global health security, and then we can get on with building the blocks on the foundation that lays. I believe that is the only way we can actually make the changes we need to make. But we leave it to you, our Member States. We are a Secretariat. We will be guided by you. We will carry out to the letter the instructions that you give us. We have great hope for the future, for a safer, fairer, and more sustainable world in which human, animal, and planetary health are co-managed, and we co-create a more sustainable future. Thank you.
Thank you, Mike, for your concluding remark, for your leadership in leading the WHO emergency program in both pillar, preparedness and response. I would like to thank the Right Honorable Ellen Clark, Mr. Harsi, Professor Bloomberg, and Walid Ammar for their contribution today. I know that we didn't have enough time to discuss and ask questions, but with the dynamic that this idea created now, I think this is only the start of a process of consultation, of discussion, that we are going to be very pleased to work with Member States in conducting this process of consultation. And of course, I would like, before concluding, to leave you with one message. This is the time to act. We must prepare for the next pandemic today, and Dr. Tedros said it yesterday in his speech to the Assembly. Again, thank you very much, and I wish you a very successful Assembly, and Committee A will start in 4 minutes. Thanks again.